Good afternoon, everyone. Today's distinguished lecture will begin shortly. Please take your seat and switch your electronic device into silent mode. Thank you.
Good afternoon, everybody. My name is David Bish. I'm the director of the Hong Kong University School of Public Health, and I want to welcome you all. Given the title of the talk, we all have an interest in this topic, don't we? We live in a city, and we want to survive, and we want to do better than survive, and I know that Professor Cutler will help us understand that. I won't give you much of the bio other than he is such a luminary, such an icon in our field of health economics, especially his contributions to the economics of public health. One of the papers that has inspired me for years, I assign it to my students, is a contribution he made with Grant Miller about the contribution of public health to increase survival in the US, where he showed that 38% of the mortality decline in America comes from the work of public health in improving sanitation. Just the sanitation was 38% of that mortality decline. Return on investment of every dollar invested in public health in America paid off $20 to $25. So an amazing investment, amazing contribution, but telling you that our speaker today gets public health. Hong Kong is proud of what it's done in public health. We actually had the nephew of Edwin Chadwick come here. Chadwick was the godfather, the father of public health in London. Sent his nephew here, Osbert Chadwick, in 1880s. Just about the time England starting its public health, the nephew of Chadwick comes to Hong Kong and gives us consultation about our water system. So every time you go to Victoria Peak and you look down and you see that Pak Fu Lam Reservoir, you're seeing this legacy of the British sending public health here. Now, it took us a while to catch up to London in public health, but our city now, as we know, is leading. We are 4 years ahead of life expectancy of London. So the student has now become the teacher in a way, and we here in Hong Kong have a lot to say about the survival of the city, and we're so eager to learn more about how we can do more than survive. We'll turn it over to Karen Greppin to introduce our speaker.
So good afternoon, and thank you all for coming. This is an enormous pleasure for me to be able to do this today, which is to introduce to you Professor David Cutler. Professor Cutler, if you don't, well, I guess if you know anything about health economics, you know who he is. So I'm speaking to the rest of the audience. He is one of the world's leading experts in health economics and public economics. He has an undergraduate degree from Harvard in economics, a PhD from MIT in economics. He is currently the Otto Eckstein Professor of Applied Economics in the Department of Economics at Harvard. He also holds secondary appointments at the Harvard Kennedy School and the Harvard T.H. Tan School of Public Health. Like many people who are really, really important, you're going to have a really short bio, which is he just has done an enormous amount of things. He's written a number of really enriching books, one of which he will share many of the takeaways with us here today. Other really important roles that he has held, he has been an advisor to many important institutions with regards to the development of health insurance and health systems in the United States. For example, he served on the Council of Economic Advisors and the National Economic Council during the Clinton administration. He advised Bill Bradley, John Kerry, and Barack Obama as they were running for president. He served as a senior healthcare advisor for the Obama presidential campaign, which, as you know, subsequently went on to lead to one of the most substantive reforms to the health insurance system in the United States. And perhaps, I think, in my mind, the most important advisory role he played was he was my own academic advisor. So that's the connection. But anyways, I've seen a preview of this talk. I'm sure it's going to be exciting. So thank you so much for coming. And I introduce Professor David Cutler.
Thank you. Good afternoon. How is everyone? Good? I want to thank you so much for inviting me here. This is such a great pleasure to be in Hong Kong. I was last in Hong Kong before this about 30 years ago, and things have changed a little bit in the past 30 years. So it's wonderful to be back, and I hope I come back before another 30 years. Thank you, David. Thank you, Karen. Actually, Karen left out the biggest accomplishment that I'm most proud of in life, although she got to it very, very briefly, which is advising students. So one of my very, very favorite things to do is to advise students. And I've had a number of students who I've loved over the years. And like all good parents, I don't have favorite students. But if I did have favorite students, one of my absolute most favorite students would be sitting in the audience here today, because she embodied a desire to learn with an ability to teach me about all sorts of things. So she came in with interests in the US and Canada and the Philippines and Africa and Europe and so on, and said, no, I really want to do all that stuff. And I said, but I don't know all that stuff. And she said, so I'll teach you all that stuff. And so I feel like I've been a student of Karen's for about the past 20 years or so since we first met. And I occasionally give her some pieces of advice, and she frequently gives me lots of pieces of advice. So I am just incredibly grateful, and you are, as a university, extremely honored to have her, and as a person, you know, just as an institution, and having such a person. So thank you, and thank you for inviting me here. This is about a book about, so first it's with my colleague Ed Glazer, and it's a book about COVID, but sort of in a larger context. And so I want to think about COVID and its implication for cities in a larger context. But let me just start off with like an observation or two, which is that cities are among mankind's greatest inventions. So if you look, people live longer in cities. They're happier in cities. They earn more in cities. Like, people are social, you know, humans are social, and so they like being around other folks and stuff like that. And so you know, all across the world, people are going more and more into cities. Like, you know, the thing limiting people from going into cities is that, you know, at the margin, you know, the living conditions are very poor, but, you know, outside of cities, they tend to be poor as well. So like, that's sort of one of the greatest things. So what is a city? And kind of economic definition of a city is a city where a city is a place where everyone comes together in the same spot. Okay? And the problem with that is that, like, some stuff pushes you away. And one of the biggest things that pushes you away is disease. Right? So cities are like places where people are productive and they earn more and, you know, so on. And yet there are things that drive them away. Sometimes it's disease, but not always. You can see here, like, where the big cities are, you know, varies a lot across the globe over time. Cities grow a lot, like London grew a lot, New York grew a lot, but like then they also decline a lot too. Like London had a hard time, and New York had a hard time, and my home city of Boston had a hard time, and Hong Kong had a little bit of a hard time during COVID and stuff. So like, cities seem like they're more fragile. And so that sort of raised for us the question of like, how do you think about cities being places that we love and that are really good for us versus the sort of fragility? And so why the fragility? In my mind, there are really two reasons, but they're actually quite related. They're sort of underlying problems that we have to address, and when we don't, they can be really problematic. And so the first one is disease. So cities have long been places where disease was far more prevalent. I'll show you a little bit about that. And then the second are non-disease factors, and they're particularly in things like, I'm going to talk much more about the US because that's where I live, that's where a lot of my research is. At the end, I'll talk a little bit about Hong Kong, but I'll talk much more about the US. But there are a bunch of things about cities that make them be very difficult too. So they have crime problems. Crime is a much bigger issue in the US than it is in Hong Kong. And they have problems of housing prices, although Hong Kong has a much bigger problem of housing prices than do cities in the US. And they have problems of segregation and stuff. And a lot of those, they sort of seem like they're separate problems. But in reality, what COVID is a kind of another one of those insults that affect urban areas. And so the question is like, are they going to make us all want to be further away in the way that a city with a lot of crime and a lot of inequality that you can't get anywhere, and the city schools are bad and so on, wants you to move away? Or are they going to be hubs in the way that Hong Kong has been a hub, and New York has been a hub, and London has been a hub, and so on? So how do you balance the sort of pulling people together and pushing people apart roles? And so that to me, that's kind of like one of the central tensions here is how does one go about balancing that? So let me start off on the disease front, and then I'll come to the other part. The disease front, so disease has always had an urban component ever since humans sort of left the savanna and living in very small groups and gathered into agricultural communities some numbers of thousands of years ago. And you can find references to all sorts of diseases through history. This was the Cyprian plague in the 3rd century. This is not a picture. This is a sort of an AI representation, or before AI, what was a representation of it. Athens was one of the Western world's first great cities, and Athens fell because it lost to a big war to Sparta. And oh, by the way, partly the reason it lost the war is because it had a plague that, in the war, half of Athens was killed, and in the plague, a quarter of Athens was killed. So there was another half, which was, from other stuff. So all throughout history, you can sort of find the disease process. And you see here this sort of timeline of kind of pandemics, right? They've sort of, they sort of, periodically, like, pandemics, come up. And you can see, like, the bigger ones, the bigger circle, like the Black Death in Europe, which killed about a third to a half of Europeans. The other big one here is the Great Flu of 1919, which killed just an enormous number of people and so on. And for a while, it seemed like we had conquered urban pandemics. Right, so if you look at New York, this is mortality rates in New York over time, and it looked like, it had gone from very high. New York had a lot of cholera. In the U.S. cities have a lot of stuff depending on what the weather is like and so on. So it'd be yellow fever in Philadelphia and cholera in New York and various other things. So it looks like New York had conquered cholera. How did it go about conquering it? Well, the way you cholera is a waterborne disease, so you clean up the water. So we had, sort of running water put into houses and sewers out of houses and so on. It's sort of an interesting story how that came about, which is that it did not happen by happenstance. Like, it wasn't like people said, oh gosh, I can now have running water and so on. It was that actually the public health commissioners, not even the mayor, the public health commissioner of New York would go to the landlords who owned the house and were renting it to a tenant and say, look, you can either put in clean water and sewer hookups, or you can stop renting. The choice is yours. Which one do you want to do? So it was very much a public health effort without outs. No outs. No, well, I'm I have a religious objection to putting water and sewers in the house. We didn't really care. Either you did it or you were out of the business. Reminds me of Thailand with HIV, where, they wanted a safe sex industry. And it was, look, either you have 100% condom use in the sex industry, or you're not in the industry, and you choose which one you want to do. And so that's sort of our long-term strategy. It looked like it was sort of really successful, but then actually it wasn't really successful, because if you look, there have been a lot of sort of potential pandemics, right? Sort of things that never got to be big, but were kind of, issues floating around. The one, of course, that's not really here well, or that you kind of want to think about, is HIV, which is also a huge issue, and that should have been a warning sign for us. The reason why we don't think about it quite the same way is because there are actually behaviors you can take that will guarantee that you won't have HIV. So it's not the same way as a kind of viral disease. But, there was always that sort of component, which was like the disease environment is out there. And then, of course, then COVID came. Okay. And so COVID, and so partly it's like, okay, so now finally, what happens with COVID? So COVID was bad. You see the world death totals, but actually in many ways, the world was lucky, because it could have been far, far worse. SARS was far deadlier per case than COVID was, and MERS was far deadlier per case. And vaccines were developed really quickly, like, the 9 months from basically understanding to approve vaccines, which is like shorter than any thing ever. So some things worked very well during COVID, like, the vaccine development process worked very well during COVID. And then a lot of things worked very poorly, particularly in the US. We have a list of failures that goes on for many, many pages. I think in Hong Kong, there are things that didn't go as well either. In every country, there were some things that went really well and other things that didn't go particularly well. What I wanted, but coming back then to the central tensions, COVID absolutely had an effect on cities. So if you look at big cities in the U.S., and you look at what their growth rate was, right? So just like the rest of the world, people are moving to cities in the U.S., and then during COVID, they stopped. Because why move to San Francisco if like nobody is actually doing anything in San Francisco? One of the cities that was hit in the US hardest by COVID was San Francisco, and I'll talk a little bit about why. Where did people go? So does this mean that people went back to the sort of heartland of Iowa? So this is San Francisco. I told you I'd show you a little bit about San Francisco. So COVID came, and unlike Hong Kong, there was a lot of like work from home in the US. So office and it hasn't really returned. So office vacancy rates in San Francisco were about, call it 8%. That is 8% of offices were unused. And it's now above 30%. And that's recent data, and it's still going up some. What tends to happen, what's going on here, how many of you have been to San Francisco? Okay, so San Francisco basically does not allow you to build high-rise housing. Okay, so there's single-family housing, which means that the number of people who can live in the city is very low, which means if you've got a lot of workers, people have to live far out. So people would live very far out, and they'd commute like an hour each way to work in their job in San Francisco. Then COVID comes, and everybody's working from home. And then COVID is sort of over, and people are like, why should I commute an hour back in? Like, I could kind of work at home. Like, I'm not doing anything that I physically have to be there for. And then when some people don't come in, other people don't come in, because why come in to be in the office when nobody else comes in the office? And then because there's not that many people living there, there are lots of streets that are more or less deserted. And then there are people kind of living on the streets. And the US has a big drug addiction problem, and so the drug addiction problem is on the streets, and that then makes it even less likely that people come in. So you sort of see the spiral happening, and sort of San Francisco is the example of the spiral. It will not spiral to zero because San Francisco has a ton of natural resources. It's got beautiful weather, it's got a great harbor, it's got lovely stuff and parks and so on. But it's an example of how fragile you can be. That is, the city was going great and everyone was, quote, loving it, except for the people who had to commute an hour each way. And then you sort of you sort of put a little sort of explosion in the middle, and then people kind of scatter, and they don't really want to come back. So where are they going to? Well, in the US, this is where they're going to. The big cities are down. New York is down, Chicago is down, Boston is down, Los Angeles, San Francisco are down. And the blue cities are up. Las Vegas, so I'm going to call them out. Raise your hand if you've ever been to these cities. Las Vegas, okay? Phoenix. The Americans are raising their hands, but Dallas, Austin, Nashville. I got only one person. Charlotte, North Carolina. Jacksonville, Florida. The feature of a lot of this is that you haven't been there. Right? And why haven't you been there? Because they're not like the world's top tier cities. So they're not the country's top tier cities. So why did people move there? Because the housing is cheaper. In San Francisco, it's impossible to afford housing. In Los Angeles, you can't afford housing. In New York, you can't afford housing. So if you're going to leave the city, if you're saying, I'm not going to come back into San Francisco to work during COVID, why don't I go somewhere else where at least I can afford housing? And if I'm not going to come back in afterwards, maybe I should like just stay there. So you can see what happens. You sort of see the fragility here, right? Like if San Francisco is not a place I can go and like do well and live the American dream and so on, fine, let me go do that somewhere else. Now Nashville wages are not as high for exactly the same thing as in San Francisco. They're not. Like the exact same job pays more in San Francisco and New York than it does in Nashville. But the standard of living will be higher in Nashville. So what we've done is we've moved people away from the most productive areas, that is the areas where they produce the stuff that gets reimbursed the most, into less productive areas. Why? Because we failed to accommodate people. So you see here why COVID is kind of like lack of housing, right? It's sort of, they both drive people away. In fact, they interact with each other. When you have COVID, you drive people away, and by the way, they're going to move away if they can't afford to live in some place that seems consistent with what they want to do. The cities that are in yellow here are the ones that traditionally people went to kind of get ahead. You know, immigrants came to New York and then they went to Chicago, and people moved from the Midwest to out in the West. And like the whole history of the US is moving that way, moving into those things and moving that way. And we're sort of rewriting that because those things have become kind of unaffordable for people. And so now the gateway to doing better is move to Phoenix and get your little patch in the desert, because they'll build forever in Phoenix. So house prices aren't that high because you just keep building more and more into the desert. So it's this sort of kind of fragility of the whole thing, and that sort of makes you wonder. It's not that people are going to go back to rural areas unless, you know, the next COVID is super terrible, but it's that we're not kind of living. It's not the life that people want. It's not what people thought they were signing up for. So to my mind, there's a really big issue, which is COVID can play havoc on cities. If you go back to San Francisco, it's not entirely clear to me whether San Francisco will or will not really recover well, or when it'll recover well. It will always recover some. You know, San Francisco is way too nice a place to do that. But let me take a couple of these other cities to tell you what I mean by not recovering well. There's Cleveland. So Cleveland is over here. Anyone been to Cleveland? Cleveland's population is down by 2/3 from its height. So there used to be 1 million people in the city of Cleveland. There's now about 300,000. Detroit, anyone been to Detroit? Detroit's population is down even more. Neither of those have incredible natural resources. Like, you don't look out at the, you know, at the Detroit River and say, oh, this is lovely. I really want to spend my evenings wandering around the Detroit River. And you don't go to Cleveland. I mean, it's on Lake Erie, but it's in the snowy part of Lake Erie and stuff like that. So neither one has the sort of inherent beauty, weather, other amenities that some of these other cities have. But absolutely, you can just have these sort of cataclysmic changes, right? Like at one point in time, a little over a century ago, Detroit was the place in the US. That was where people went. My grandparents immigrated, and like they all settled in Detroit because like Detroit was the booming industry, and my grandfather ran away from his home to run to Detroit and stuff like that. And Cleveland was like, you know, a big booming industrial area and so on. And you can destroy all that, and you can get down to where, you know, there's just vast open areas in these cities. It's unusual for Hong Kong, right down, if you think of down by the waterfront, but you can just have vast open areas of unclaimed land and stuff like that. And so all of that is kind of, is sort of possible. So how do you prevent this? I want to talk a little bit about this, less because I'm going to bring novel things to bear, and more because I think I've got some degrees of insights on some of the specifics that I want to highlight. So how do you prevent disease from playing havoc on cities? So there are 3 things that I want to talk about. One is globally, which is we need some alliance for health that's stronger than the WHO. So the WHO does all sorts of things. It does a ton of things, does many of them well. Preventing pandemics is not a thing it does greatly. You know, so, you know, China gives the WHO a lot of money, so it's deferential to China. And it doesn't want to cut off tourism to West Africa, so it doesn't announce when there's an Ebola outbreak and stuff like that. It's not that hard. I sort of gave this the other day, so if you know the answer, don't answer already. When I asked a friend of mine, like, what would you look at to see, like, if we were having, like, for an early sign of another pandemic, what would you look at? And my friend said the price of chickens in Thailand. So now here's your quiz question. Why the heck would you want to know the price of chickens in Thailand? This is the audience participation part. When is the audience part? Yeah. Bird flu. Because if it spreads to chickens, that's a problem. Whatever it is, if the thing spreads to chicken, that's a problem. And how are you going to know if it spread to chickens? Because in the markets, there are not going to be very many chickens. And what's going to happen to the price of chickens if there are not very many chickens? The price of chickens is going to go up. So if you want to tell, like, do you have a bunch of bird flu, you see what's happening to the price of chickens on the market. So things like that we should be looking at. How many people, someone suggested the other day, how many cars are there in the parking lots of hospitals in places where people drive to hospitals? You know, or how many people are taking the bus to medical care facilities would be another thing. Look at the equivalent of Google searches. How many people are searching for sore throats and, you know, respiratory difficulties and all sorts of stuff like that. So there's a bunch of stuff that we could do here. We basically don't do much of that. Our current strategy is to rely on countries to tell us what's going on, and then countries have all sorts of incentives not to do that and to fudge the data and to, you know, do all sorts of stuff like that. The example that I think of in my mind is not so much the WHO. This is a sort of weird example to say in China, I understand, but the example I think about is NATO, where NATO is, if you will, a technical body. It's designed to prevent nuclear war with Russia. So it's designed to protect the West from nuclear war with Russia. And NATO, like, doesn't, if you will, bend with the wind. Like, you know, if Poland, you know, wants to do something, but it's not in the interest of NATO, tough luck. Poland doesn't get to do its thing. Because, like, there's a mission, and the mission will be done. And it's a technical organization that does its technical thing. And I think part of the problem with the WHO is that it's a technical organization that does its political thing. And just, like, as a personal matter, I hate when scientific bodies make non-scientific decisions, because it's just a recipe for doing very badly. And so that's what we've got here. And so trust in scientific institutions in the US has fallen enormously because they're perceived to be very political when that's not their job, and that's not very good. So that's the first part globally. I wish I could say that we've done things along this line since COVID, but I fear we haven't very much. And you know, just to give you a sense, like, are there particular countries that you'd want to focus on? This map, which is unintelligible, is designed to be unintelligible, which is no. Like, flus and viruses and so on can start everywhere. COVID started in Wuhan. The Great Flu Epidemic in 1918 in the US, we used to call it the Spanish flu, but that was only because Spain was neutral in World War I, and so we observed it coming. We observed it in Spain more than other countries. People have now isolated where they think the Spanish flu or the Great Influenza came from. Anyone know? I'm sorry? Kansas. Kansas. Fort something or another in Kansas, where all the soldiers were coming to, you know, get prepared to go to Europe for World War I, what was then the Great War. And, you know, from there, then it spreads out. There was the South African variant of COVID, which was only South African because South Africa had good enough public health system to spot it first, not because that's where, who knows where it originated and so on. So there's a lot of, like, just, you know, anywhere in the world can have it. And I sort of think about, like, this map, and I compare this map to which countries, so in my mind, there are three great global issues that, like, threaten mankind that we need to worry about. One is nuclear weapons, which is only, like, roughly 10 countries, we hope. Second is global warming, and third is pandemic disease. And of them, the one that could kill us the fastest is pandemic disease. And so, but the problem is, like, however many countries there are, 200 some odd countries, you have to be monitoring 200 some odd countries. And not only that, you better be monitoring every area within those countries too. So this is, like, infinitely harder, I think, than preventing nuclear war. And we devote many, many more resources to preventing nuclear war than we do to addressing pandemic disease. So that's sort of the first part. The second part is we need our healthcare systems to work better. The US healthcare system was particularly bad in a number of ways. I mean, in general, it's sort of bad. And what COVID did was it sort of shined a light on every flaw in healthcare systems. So the US is bad. Single-payer countries did better. Countries run by women did well, did better than countries run by men during COVID. Countries with good public health system did best. Most Asian countries, I think, have only so-so healthcare systems. So let me sort of tell you a little bit what I mean by that. This sort of conception on the left is like what a good healthcare system should look like. It's got, like, a base of, like, wellness and prevention. And then it does sort of routine interventions and then high-tech interventions above that. And you can screw up in at least two ways. There's the US way of screwing up, which is don't do the wellness and prevention, you know, have very few primary care docs, and so, like, therefore you don't get very much of that, and then, but you have everyone be a specialist, right? So 2/3 of US docs are specialists, and 1/3 of most countries' docs are specialists, you know, so we've sort of way over tilted the thing. So that's one way to do poorly. The other way to do poorly is what I think of as the sort of Asian model, which is you kind of have primary care, but it's not really primary care, and, like, the docs are not, like, in any kind of primary care system, and they're not integrated in with what's going on in the acute care system, and there's nobody really managing your diabetes. They're there to sort of deal with you on a episodic problem kind of basis, and that's what you do in your 3 minutes with the doctor, and then you sort of go out and stuff. So it's sort of like, yeah, there's resources there, but the resources are not doing the thing that you want. And that shows up during COVID because then, people will crowd the emergency department, or people that are hesitant about taking vaccines. And then you say, well, go talk to your doctor. And your doctor's like, oh, whatever. I'm not paid for it. If I'm paid for it, I'll give you the vaccine. If I'm not paid for it, I won't give you the vaccine, or something like that. So you sort of wind up with these situations where the medical advice gets diffused through organizations that do not necessarily have the public health, best interests of public health in mind. So there's that, and we're going to have to deal with that, and the U.S. is going to have to deal with it. I think other countries are going to have to deal with it too. And then the third thing I'll say is local, which is when anyone anywhere is sick, that means everyone everywhere can be sick. So I've shown you two maps here. The one on the left is New York. The one on the right is London. They both make the same point. So let me use the New York one to show that. This is the life expectancy by neighborhood in New York. So the highest life expectancy is in Manhattan on the Upper East Side. It's the richest area. And the lowest life expectancy is here. The gap between the Upper East Side and Brownsville, the subway time, let's call the subway time 10 minutes on the subway, and the life expectancy cost is roughly 10 years. So you lose a year of life for every minute on the subway. That's a lot. Just to give you a sense of what that means, in the US, if you wiped out every single cancer, no cancer deaths at all, 0, 0, 0, life expectancy would increase by 3 years. So this gap is 3 times the total cancer death rate. Why is that? It's not because the subway kills you as you keep going on it longer, although the air quality may or may not be that good. It's because of all the stuff. So it turns out if you look at the risk factors for catching various viral exposures, they're things like smoking, obesity, unsafe sex, sharing needles. All of those things are much more common in Brownsville than they are on the Upper East Side. You may want to live on the Upper East Side, and you may want to insulate yourself from people in Brownsville, but it's functionally impossible to do that. You don't go to Brownsville necessarily, and people from Brownsville don't spend a lot of time on the Upper East Side, but people in Brownsville spend time on the subway, and someone on the subway spends time in a Starbucks, and someone in a Starbucks sells to someone who works downtown, and that someone who works downtown is in the same office building as someone who works on the Upper East Side, and within 3 or 4 links, you've basically got people there. And so anything that starts in Brownsville is going to be extremely hard to keep out of anywhere. And anything that starts in the poorer parts of London is going to be extremely hard to keep out of the richer parts of London. So if I'm the mayor of New York or the mayor of London or the mayor of Boston, I think I've got a public health problem, which is that I've got some areas where people are engaging in behaviors that are risky. And not only is that a problem for them, that's a problem for everywhere in the city. And so the local and the personal has all of a sudden become very public here. And so that's, I think, a big lesson that we're going to have to learn, which is, all these things that we say, well, it'd be good if people stop smoking, but we're not going to force them to, and so on. But that actually then becomes like a health problem for everyone, and all sorts of stuff like that. So there's just all these implications about how it's going to affect us. That's on that, and you can see it's no different elsewhere. This is Manila, where you have a lot of, spread of disease. This is Singapore here, where the outbreak was the biggest outbreak in Singapore was in the migrant housing stock, and then it goes from there. And in Hong Kong, as I understand it, it was in the old people's homes and stuff like that. A related thing about it is it turns out that education is quite protective for your health, and even for COVID. So I'll just give you this fact, which is cities where more people have a college degree had a lower COVID death rate. And actually, that's not just because people with a college degree stayed at home more. It turns out everyone, whatever your income status, whatever your education status, people with living in cities where there are more people who are better educated do much better. This is total mortality. You can see total mortality declines with education in the area, and it declines even more over time. What's going on, actually, is that literally what people tell you about things like how bad is smoking for me, so the person with the same education will tell you smoking is worse if they live in an area where more people have a college degree. Like what people actually believe about the truth about stuff differs. So it's not that they can't afford the cigarettes or their office says they can't smoke indoors, or it's like they'll tell you, no, smoking is bad for you. And you're more likely to believe that smoking is bad for you if you're around people who are better educated than people who are not. So this is a sort of thing that I think about in terms of what can cities do in addition to trying to stop smoking and so on. It's promoting a very broad-based, widespread education city that also integrates people so that the rich people are not, educated people are not living completely separate and so on. I promised I would tell you a little bit about Hong Kong. So I want to just say, okay, so where is Hong Kong on the scale of San Francisco to I don't know, where should my booming city be? To Hong Kong of 2 decades ago. Okay, so where is current Hong Kong on that basis? So first off, you can find all sorts of charts, all sorts of headlines about how Hong Kong is going to fail and it's doing poorly and stuff. These are just from the past couple of weeks. I'm not saying they're true or not. I'm just saying like in the US, there's a high demand for stories about how China is doing poorly. So people love to read stories about, China's doing poorly and stuff like that because, that makes us feel better about disliking you all and stuff like that. So we're happy to dislike you and stuff like that. If I were going to say, like, what do I think about the future of Hong Kong, I think it's actually a little bit more precarious than maybe the typical person might think. So I'll give you the case for precariousness, and then we'll see if you buy it. First off, Hong Kong actually did fairly poorly relative to Asian countries in COVID. So, of course, the US was worse. But, relative to the set of countries here, Hong Kong actually did fairly poorly. I think, sort of not officially, but, like by epidemiologically, it was sort of people in old folks' homes dying. But the real issues, I think, get back to why weren't people vaccinated? And like, how come the system couldn't figure out how to vaccinate people and stuff like that? So did very poorly. Housing is still extremely expensive. I'm not sure I need to tell this audience that housing is extremely expensive in Hong Kong. But again, that's going to make it be very, very difficult for people to want to stay here. People in Hong Kong are in the office. This is a chart that was made up by Americans, which was like, are you back in the office? Because in a lot of areas, you weren't in the office. But people in Hong Kong are actually in the office still a lot more so than in other countries, like in the US, we're sort of away. But it's, if you sort of say, what is the, where does it fall here? Well, you can kind of see a little bit, not a ton, but a little bit of like the San Francisco phenomenon happening here. Like, we're not going to do well with disease. It's really expensive to live here. Other things that San Francisco does poorly on, things like crime and stuff, don't seem to be problems. And there are other things where Hong Kong is very good. But there's still this sense in my mind about how is it going to go. I think, I'm not going to give firm conclusions about Hong Kong because I've almost exhausted my knowledge. But I just want to point out this tension, right? So cities have costs and benefits. There are a lot of benefits, and the costs we thought were lower, and now we're realizing they're higher. And that's going to mean both people are going to be somewhat hesitant about moving to cities, but also think a lot about them when they do. And to me, the strongest cities of the future will have to address these. Where else, or people will move around. In the US, you move from, San Francisco to Phoenix and Las Vegas. In here, I don't know where people would move. Maybe they'd move to Singapore, or maybe they'd move to Australia, or maybe they'd move to Europe, or the UK, or wherever it is. But, you can sort of imagine that same thing. And that's, so cities as a whole are clearly going to be here to stay, but any individual city is not. And that's, I think, going to be the challenge. And I'll just sum it up this way, which is, to my mind, the future of this wonderful thing is going to be determined a lot by how well it's governed because because there's all these challenges that we're facing, from pandemic disease to unaffordable housing to poor people and so on. And that's a question of how well can you govern things. And the cities and the countries that govern the best will do well, and those that can't will do very poorly. So it's going to be less about imagination of what the future of the city should be like, and more about nuts and bolts. Can you actually make the thing work? So that's what I tell people in the US. I don't know if it makes any sense here. I'll be interested to hear that. Thank you so much for indulging me in letting me talk, for not throwing things. If your aim is poor, you can throw things and hit the other side of the table. And I'm just looking forward to having some discussion. So thank you.
Oh, well, we're so glad that we had this discussion, and now we have the pleasure of having our questions answered. And just raise your hand and then press your little button so that your mic goes on. We get your questions. So I'll start off. I was looking at your map of America, and I saw the rising cities and the falling cities, and I know enough about the life expectancy in those cities that were gaining people to sort of make a sort of, it looks like people are going from cities with high life expectancies, they're moving to low life expectancies. A giraffe would never do that. Why is a human doing that?
Yeah, of course, giraffes don't have to pay rent, right? And so that's sort of the big, right? So the giraffes will all crowd together in the nice watering hole in the nice area. And the problem with those blue cities is that they're not letting people do that. And so I think that's a fair amount of what's going on, is that you're right. They are lower life expectancy cities. They are lower income cities. They're also, by the way, so like part of what people say in California, I grew up in California, so part of what people say is, well, we don't want to build high rises and build a lot of stuff because like it's environmentally unfriendly. Well, it turns out actually that California is about as environmentally friendly as the US comes, because you don't need a lot of heat in winter and you don't need a lot of air conditioning in summer. And in Texas, you need a darn lot of air conditioning and stuff. So we're pushing people into environmentally unfriendly areas too, in addition to all the rest. And I think it's, I think of it as kind of, if you will, sort of insiders versus outsiders. Why can you not, so they're basically the same number of people who live in Los Angeles now as 50 years ago. Same number of people. The Los Angeles area has grown immensely, so people are all living outside of Los Angeles. Why is that? Because like basically people don't want their neighborhood to change, so the insiders have the right not to let it change, as opposed to the outsiders have the right to, you know, build and to move in. And so whenever you make it easy for the people who have to keep what they have, and for people, make it hard for people to do not have to have, then you're going to wind up with that. And it's a really terrible form of redistribution we do in the US, where once you've bought in, you then have the right to have that thing forever.
Other questions? Go ahead, turn on your mic.
Oh, there we go. Thank you very much for the great talk. I'm Yanja from Geography. I actually also lived in the U.S. for a very long time, so I kind of know all the
Where
places.
in the US?
Buffalo, Iowa, Maryland, and California. So I pretty much know all the cities you mentioned about. And actually, those rising cities you mentioned, it's also like, I actually just talked to David last week about like we are also in a climate health region era, not just the pandemic or other economic driven migration. So most of the migration from this to this rising city, I feel like, for example, the Phoenix and Las Vegas, they have very poor climate. Like people die of extreme heat all the time, especially in Arizona. So that kind of contradicts the migration. It seems still like economic driven during the pandemic. Do you have any comment on this?
You're correct. In the States, it's enormously driven by housing prices. So just the fact that like the median family could not afford to buy anything in San Francisco or Los Angeles, and so therefore you will live somewhere and commute an hour in and an hour out to work, and it's like, why? And still pay a fortune. Or you can move to Phoenix where, you can buy a little house and, it's not too far from work and, whatever else. And so the ability to move areas in response to price differentials is really big. And that's probably the most noticeable feature is we used to have people move to our big coastal high wage areas, and now we have people moving to those other areas because they can't afford to do it. I don't know how applicable that is to Hong Kong. It's certainly harder to move to Singapore than it is to move from San Francisco to Austin, Texas, but it's certainly not impossible. And my understanding is some people did that during COVID and when there were other concerns and when there have been other concerns. So, that kind of thing is like absolutely something one should think about.
Thank you.
And by the way, I should say, if people don't have questions, I will sing K-pop, and I assure you, you don't want that. So I would come up with questions.
Go ahead, turn on your mic.
Thank you. Just a very quick question. So it seems like in your conclusion, you imply that the future of public health policy should be like government should really take their role to fix things. Have you ever considered like the potential, like how much the city has potential? Because a little bit about myself, I spent 2 years in Nashville. I went to Vanderbilt there. And the first year there, you can see literally there's like so many places are vacant. But then the next year, like you can see 20, 30 cranes that are working on new projects. And then my rent like almost went up 20%. So, but in your chart, you show like the population, people are moving in, and I can literally observe that. But that is because there is room for that. But other cities, like I also have friends in Cleveland, and they also show me around like, oh, that's the factory from 100 years ago. That thing has been there since, when we were still in Qing Dynasty. But we literally don't have space in Cleveland. There are certainly areas with people who are really rich and they will stay rich, but they just can't build things because you are not going to demolish existing things or like move existing people away if they don't want to, like you mentioned. So personally, like this is just my personal opinion, is like, it's not like governments are not trying to work. It's like there's a physical constraint to how much they can, what they can do with existing resources or like people's will. What would you comment about that?
Yeah, so let me give a couple of answers. So you're right about Nashville, which is there's a crane everywhere. Turns out Cleveland, there are vast parts of the city where no one lives. And they're just open. They're just, like I've been there, walk around, they're just, rundown houses that people have abandoned, property that nobody wants. If there were someone who were interested in developing it, the land would be like cheap as all heck. It would just be cheap. So it's all, but there's no like demand for it. Because there's nobody who wants to, because the city space was for 1 million people, and now there are 300,000 people. Many of the people who are living there just because they own a house, and the house is not worth much. But like, where else can you go, where you can actually own a house like that? The other side, where it is a sort of building issue, is to come back to Boston, right? So in Boston we build, but nowhere near enough to match like the number of people who want to live in. So if you're kind of young in Boston, it's, I think, a little bit like being young in Hong Kong. You sort of scrounge around for an apartment, and, it's hard and stuff like that. And you want to work in biotech in Boston or go to school and something. And it's very difficult to make that work. And it used to be, much easier. And in Boston, we just haven't built up. We don't build up that much. So there are still vast parts of Boston where it's like 3-story housing, where it should be 15 or 20 or 40-story housing. And you could like house like a lot more people that way. And the city just doesn't. And, because there's all this neighborhood preservation and stuff like that, and many people like the city the way it is, but that just makes it fundamentally unwelcoming for a lot of people, and that really saps a lot of the vitality out of places.
Edward.
So just now you showed the graph. I saw that Detroit's population has been declining quite a lot, actually since the 1980s, Professor Cutler. So I just want to ask you, is inner city regeneration a way to improve good health amongst the cities? Do you think Detroit has a chance to create like a city with like an equal life expectancy per se? Because if we're going to regenerate and like an inner city urban center, there has to be strategies that's actually better than something like a New York, Los Angeles, or San Francisco. Thank you.
Thank you. One of the tenets, I think, of economics is that when in doubt, invest in people, not places. So we don't really care about the place, we care about the people. So when I'm asked, like, what would you do to take places that are not doing well and like have them do better, I would say over time, the best thing we know is, I showed you the chart on education. The best thing we know is that the cities that do the best are the ones where they have the most people who have more education. And that's good for health, it's good for innovation in the city, it's good for business startups, it's good for all sorts of things. So if I have like one marker about what I would do, it wouldn't be to like build a people mover or to try and refurbish some downtown thing, like all these things that Detroit has tried over time. It would be to have a very educated workforce. And same thing for Baltimore, and same thing for like, just lots of cities that way. Lots of good things follow from having a well-educated population.
We have time for one more question. Go ahead.
So I'm Canadian, so we also like to hear. Sorry. I'm Canadian. We also like to hear terrible things about the States because it makes us feel better. But I was thinking about what you were saying about the San Francisco office vacancy. So I'm from Vancouver, and I think that they're very similar cities altogether. Similar climate, they're both port cities, very high cost of living. If anything, it's a bit higher in Vancouver. But we don't have anywhere near as high of an office vacancy rate. What do you think that is, how it is?
Yeah, so of course Vancouver is right across the border from Seattle. And Seattle also has a reasonably low office vacancy rate. There's still some, because depending on how far out people were living, they do or don't want to come back to the office very much. San Francisco is really among the worst because it had set itself up the worst. Like Seattle still has more people in the downtown area. Boston still can't provide enough space for all the biotech companies that want to work there, because you have to do that in person, and you can't really do much of that outside of it. So I would be interested to see how Vancouver compares to Seattle. I wouldn't guess that they would be very different, but if they were, it would be some function of like how much they were able to build, and therefore how close people are, and therefore how comfortable people feel with coming back in to work and stuff like that. In the US, a lot of employers want people to come back, but come back even more than they have. But it's very difficult to do that when lots of other employers aren't, and the labor market is sufficiently tight that you have to cater to the workers some, and you can't demand them to do that, or they will leave. So the other part of it is probably just in general, how are the alternatives? That is, if the alternatives are not very good, then when the employer says you have to be here 5 days a week, you're there 5 days a week. And if the alternatives are really good, then if the employer says you have to be there 5 days a week, you say, I'll find a new job. So the other part of it is like, what are the alternative things I can go do?
Well, once again, show our appreciation for Professor Cutler's remarks. Thank you.
So thank you for everyone for the question. Thank you, Professor Eckstein, for facilitation. May Professor Cutler and Professor Eckstein please remain on stage. May I invite Professor Grappin to come forward to the stage and to where we want to invite Professor Bescheid and Professor Griffin to present token of appreciation to our speaker, Professor Cutler. And the souvenir represents our gratitude for his enlightening speech. Thank you. Thank you, Professor Cutler, Professor Bescheid, and Professor Griffin. Thank you, everyone. So this concludes today's lecture. On behalf of the Hong Kong U School of Public Health, we would like to express our gratitude for your presence today. We hope you have taken inspiration home with you. We wish you a pleasant day. Goodbye. Thank you.